youth health, mental health, and physical health communities to support the wellness of people across Canada.
There are always going to be organizations that specialize in substance use and addiction.
We have to work together. We have to be humble.
All these organizations here are recognizing that even if it's not the main focus of what they do, it has to be part of what they offer. You can't run a homelessness organization without recognizing the importance of addressing substance use issues. You can't run a policy shop without recognizing this. You can't run a hospital. And it's just it needs to be taken out of the shadows where it's stigmatized and where people just feel that they only belong there and brought out everywhere else.
We've been working with CAPSA for a number of years, really to promote an understanding of the spectrum of substance use and to move towards that person-first language where we see people ahead of any kind of disorder or labels that can be harmful.
Because stigma is a culture. And if we want to win against stigma, we need to be really educated to know how to avoid, how to help people to avoid that fear around discrimination.
And those barriers are real, they're there. So we need to work to remove stigma.
It's also so important to face stigma straight on. Okay? Not shy away from it and have those difficult conversations.
That's why it's so great to see that an organization like CAPSA, one that's really led by people with lived and living experience, can be centered in this discussion, but also is the one lifting it up, right? And this is what people are saying. They're saying we want to be taken seriously and that we need the help.
We've come a long way. There's still stigma. And by having everybody here, it leads to more collaboration. It leads to normalizing that sometimes people need to ask for help, and that's totally fine and encouraged to be the best that you can possibly be.
You know, when we talk about Black mental health, I mean, we're talking about mental health and, you know, not just the mental health of individuals, but also of communities as a whole. And, you know, being able to participate in events like this and bring our community into the broader community and show what supports are available, to show what work we're doing in the community is so important.
We often will provide information to our patients on different services in the area, but you know, you're restricted by what you know and your access to those. So I'm really hoping to get to know other services as well today.
But when it comes to wellness, we have an expression in Algonquin. What we say is, "Pagidwan kegon." Whatever is bothering you, you need to release it and let it go.
When you have a client and you're kind of pushing them to different resources, it's really discouraging for them because they're coming to you and they're looking to get the help that they need. And, you know, if you're passing them down 6 different people for different situations, you know, at that point, they might be already at the point of giving up. So I think if we are working together, it's really important that, you know, it's kind of like a one-stop shop. We can be able to help throughout the whole process.
As people in crisis afterwards, they might get a list of resources. It's very long. Who do they go to? Who do they connect with? It's hard for people to navigate that system.
No one organization can really do it all, especially, you know, in these challenging times. We need as many hands and as many feet on the ground doing the work, contributing.
I think it's so important to show us working together and have the officers seen in a different light, that they're in helping compassionate roles.
The number of interactions with police officers where we would deem it a mental health or addictions crisis, it was about 10% of the time that somebody was being referred to an agency for support, as opposed to we're now 2 years away from that. Our team's been in for about 1.5 years, and we're now up to about a 41% diversion or referral rate, which means the person's not going to hospital, and we're effectively able to transfer them or connect them with a community service that is the appropriate support for their issue.
Well, I mean, the research is out there, right? Physical fitness and mental health go hand in hand. If you're working on one and working on the other, your chances of recovery or of living a happy life is, it does certainly increase.
CAPSA was established to remove barriers to care for people who use substances. Today, we have more than 100 community partners standing beside us, working with us to remove these barriers by putting an end to systemic stigma. They in turn have demonstrated valuable humility in learning from an organization of subject matter experts with lived and living experience. They have agreed to work alongside CAPSA in its efforts to dismantle stigma and transform systems and improve substance use health of people living in Canada.
So that people will be able to find what they need for wellness, whether it's prescribed opioids or inpatient treatment, mental health counseling or peer support, maybe a running group or a social network or a community recreational program. These are all important for wellness for different people.
I think it's very important because in that way, doesn't matter the mental addictions or everything, when we are sick, practically because this is a disease, doesn't matter what kind of organization, but if we work together, we can help the person to get better and recovery for anything.
Everyone has different needs. Everyone comes from different stories. Everyone's here for a different reason, one or another. So it's really important to break down those barriers, create those rapport, create community connections. So that way we know more, of course, and then we can translate that knowledge better to our guests for sure.
But for sure, we still have a long way to go to break down those silos, and events like this can really make a difference.
It's been really important to see the other resources that are out there and really support the community as a whole. We've had clients come through today, we've met lots of community partners, and I think it positions us better to care for our own clients.
Well, I think this is where our people are. For one thing, we've met so many amazing people here. And we actually went beyond our dreams in how many people we were able to connect with.
Well, you can imagine how wonderful it would be if you weren't well today and you could pick up a phone or send a text message or go online and find all this in one place. And that this is actually just a template of what we need. An example, and it's not supposed to be a day, it's supposed to be how our society works and helps each other. And so that's called coordinated access to integrated services on a step care basis. And so that if I just need to talk to somebody today, I can do that. I don't have to self-diagnose. I'm never going to go anywhere again where I'm not sick enough or I'm too sick. And no one is ever going to tell anybody in this community again that we don't serve anyone like you here.
We're all out here doing great work, and if we could work better to support those clients, why vie for different funding and services when we could actually do a warm handoff to a community partner who could provide better care? So I think you can't be everything to everyone as an organization. There's only so much funding going around. So I think the idea is that we do better, we all do have to integrate better.
Each and every one of us has such a significant role to play in reducing stigma, and just being here today and showing our support and making those connections and having those conversations is a great way for each of us to step up and play that role in reducing stigma.
Close partners with CAPSA and the Royal in building a better world where access to treatment doesn't meet barriers.
And when I look at it, sometimes I look at it as breaking down the silos, but really I look at it as everyone kind of pulling their weight when it comes to this.
I'm happy to announce today that Ottawa Public Health is going to actually literally be standing beside CAPSA in terms of a nurse is literally moving in to work alongside the CAPSA team. Because we know, together we can learn more about how to be effective in changing systems and learn from each other, broaden the reach of some of the anti-stigma work.
So I think it's really important for CCSA to be here as well as all the other partners so that we can really lend our voice to this idea that people who use drugs and alcohol matter, that people have a right to be well and healthy. I think that's part of the problem, is that we take health as a human right, we take it for granted, but we haven't gotten to the point where substance use health is seen as a right that people have.
So Gord told me, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, It's the only thing that ever has.
And then I think the shift to this WOW movement has meant that we're not just looking at it from this little tiny lens of addictions, you know, like this big. It's now part of overall wellness, right? Overall health, right? It's not this separate entity that's, you know, historically been stigmatized, and, you know, this is just part of wellness, part of health.
Today shows that this is not merely a dream, it's happening right here, right now, in this place. So thank you everyone for coming. Merci beaucoup. Miigwech.